I'd like to introduce you to a patient of mine. Let's call her Lacy. She's a 7th grader who loves makeup and anything that sparkles, just like any other preteen, except she has a secret routine, one that no 12-year-old should ever need to know. When painful abscesses form on the insides of her thighs, she treats them herself with the resources she has: rubbing alcohol and duct tape. It's worked before, so when one flares up again, she toughs it out. But this time is different. Fever, body aches, hours of pain. She waits for her mom to get home from work, hoping they can finally see a doctor. But there's one shift left in her mom's 6-day run. So they treat the fevers at home and keep up her tried and true method. By the time she makes it to me, 45 minutes away at her local pediatrician's office, she's had 2 days of fever. She's in agony, and she's just tired. Tired of being in pain, tired of trying to fix it herself. Her scars told me this wasn't new, and I had a choice. I could do what many providers might do: express the abscess, prescribe antibiotics, and send her on her way until next time. But what if there doesn't have to be a next time? The truth is, Lacy's infections were a symptom of something else. She was struggling with obesity, a chronic condition, one that comes with discomfort, embarrassment, and stigma. And because of that stigma, the CDC says 30% of pediatric patients who meet the diagnostic criteria for obesity have it addressed by a provider. Let that sink in. 70% of these kids are seen, but not truly seen. And that silence, it costs them their health, sometimes even their life. Long before COVID-19 shut down the world, the pediatric obesity epidemic was already raging. According to the CDC, in 1999, 13% of American children had obesity. In 2023, it was 21%. 1 in 5 American children. That's 1 in 5 children at increased risk for type 2 diabetes, cardiovascular disease, and fatty liver disease, to name a few of the common physical conditions. There's also anxiety, depression, low self-esteem, and social isolation. It's rough out there for these kids. And yet, our system is overwhelmed. As providers, we carry large patient volumes, ever-decreasing reimbursement rates, and just no time. So what happens? As my adolescent patients say, we treat and yeet. We spot the acanthosis nigricans, draw labs, see no diabetes yet, and recommend healthy eating and exercise, and move on to the next patient until the labs are worse, until the depression is deeper, until the damage in adulthood is harder to undo. Now, some say pediatric obesity is a parenting problem. Then how do you explain 2 children from the same family, one who struggles with obesity and one who doesn't? Others blame our food, unhealthy, processed, and expensive. Yet some kids thrive on poor diets while others struggle despite eating the highest quality foods. Then there's technology. Kids just need to put down the screens and move their bodies more, right? But I'm seeing kids playing 3 sports and still struggling. See, to me, these are all just circular arguments that lead to no solutions. Because pediatric obesity is not a simple behavior issue. It is a complex, multifactorial condition shaped by socioeconomic status, genetics, environment, trauma, and so much more. When a child has asthma, we don't spin in circles asking what the family did wrong. We just treat them because they can't breathe. Why should pediatric obesity be any different? In 2023, the American Academy of Pediatrics released its first ever Pediatric Obesity Treatment Guidelines, calling for early intervention, family-centered care, and lifestyle treatment within the medical home. This is achievable for far more than just 2 clinics in the state of Alabama. I believe real change starts with addressing 3 core challenges: social determinants of health, shame, and stigma. Social determinants are the everyday realities that affect a child's health: where they live, what foods they can afford, their parents' work schedule, their access to care. Our first step is not a scale or a lab result, it's a conversation. We talk about diet, activity level, mental health, food access, family culture, and budget. Then for 45 minutes, we listen, learn, and meet them where they are. Sometimes that looks like connecting them to a social worker. Sometimes that's figuring out a way to stretch groceries. Often, it's simply clearing up what's truly healthy. Because when we understand a child's life outside of clinic, we can create simple, sustainable steps toward a healthy future. Next is the shame and stigma. Obesity is one of the only conditions where people feel entitled to judge just by looking. And when a child hears enough negativity about themselves, they begin to believe it. Which is why one of the first things I tell every patient and family is, this is not your fault. This is a medical condition, and we're going to tackle it together. For Lacy, it started with a question. What do you feel is causing these abscesses? And there it was. She looked down, ashamed. So I sat in that silence with her. I waited. Then we began. Lacy lives in a camper with her mom and 2 younger siblings. Her mom works long hours at a local factory. They shop at Dollar General for their groceries. She can't exercise indoors. The space is too small, and the area outside of her home is not safe. So we started small. No more sugar-sweetened beverages. Trade sugary cereals for Greek yogurt in the morning. Walk the track in PE. That was October of 2023. She weighed 323 pounds, a BMI of 49, class 3 severe obesity. Today, she's down 72 pounds, her BMI 38, her waist circumference 4 inches smaller. But more importantly, she and her mom now understand her body and how to care for it. Meeting families where they are heals. Since starting a clinic in 2023, 97% of patients saw an improvement on at least one obesity-related health measure. Over half reduced their BMI and waist circumference. 60% of pre-diabetic children lowered their A1C, and nearly half of those are no longer pre-diabetic. Of those kids who already had high cholesterol, most improved all of their numbers. We've also seen better self-esteem, healthier body image, improved grade point averages, more confident, informed families. This may sound impossible, but it's not. We do it every day. Insurance reimburses it. Families show up. Change happens. Honestly, these families are carrying weight they were never intended to carry alone. When we step in, when we walk alongside, everything shifts. So I'm asking, step in. Start the conversation. Create space. Because when we show kids they matter, they respond. And when they respond, lives change. This all started with the simple determination of a few people to make a difference. Today, we are changing the trajectory of our kids' lives in rural Alabama. So I leave you with this. Take off your watch. Sit with families. Ask questions and listen well. And then take the road less traveled and walk with these kids toward a healthy future. I promise it'll make all the difference. See you out there.